Hey, good afternoon, everyone, and welcome to your Lung Health and Wellbeing event. Thank you for joining us today. My name is Noah, and I'm the Macmillan Health and Wellbeing Coordinator, and I'm based here at the Ulster Hospital. Okay, before we start, for confidentiality reasons, all attendees today will not be visible to other attendees or panel members. Panel members are aware of those who have registered for the event, but cameras and mics are not functional, so we won't be able to see or hear you. You will, however, be able to engage with the event, and I'll explain more about how you can do this later. So what's today's event about? Speaking with patients and families, we've been told that whenever they've completed a certain amount or finished their treatment, it can be hard to know what happens next and who you can talk to. We recognized that this can be a difficult time and that there was a strong need for information and support, not just about the clinical follow-up, but relating to the broader issues associated with recovery, such as emotions, returning to work, physical activity, and travel, to name a few. So today is our way of coming together to remind and reassure the help and support that remains in the system for you and how you can access this. Today's event will help you learn more about follow-up, what to expect, who to contact, and when to do so. It's also an opportunity to find out about the information and support that's available to you during your recovery or living with a diagnosis. It's also an opportunity to find out about the information. There are a whole range of supports and services out there who can provide guidance and help you to live well with or after cancer, and our service can help signpost you to them. You will see on the program that you will shortly be hearing from some of our healthcare professionals. We have pre-recorded these presentations, but some of our speakers are here for any questions you may have. All questions can be sent using the chat function. This can be found at either the top or the bottom of your screen, depending on what device you're using. You will see 3 dots. Once you select that, you'll be given an option to use the chat feature. Questions will only be seen by panel members, and we'll answer any questions at the end of the event. So we understand that everyone's journey is different, but there are common themes which emerge that affect people, such as fatigue, building your strength and stamina, building your self-confidence, and dealing with some of the emotional implications of having had a cancer diagnosis. I think it's very important to recognize that you're not alone if you're experiencing any of the things I've mentioned, but it's also important to note that there is still lots of help and support out there. Today is really about taking the chance to review things, seeing if there are areas of your life that can be improved, helping you take ownership of your recovery and self-care, and starting to put pieces in place that are going to help you live really well. So with that in mind, I'd like to hand over to your clinical nurse specialist for a quick introduction.
Good afternoon, everyone, and welcome to our first Lung Cancer Health and Wellbeing virtual event. For those of you who haven't met me, I'm Karen Foden, and I'm one of 3 lung cancer nurses in the Ulster Hospital, and my colleagues beside me here will introduce themselves in a moment. You will have met one of us at some point since your diagnosis of lung cancer was made, and we will have offered you a lung cancer information pack with our contact details, but we appreciate that you get a lot of information and it's difficult to remember everything. So we wanted to take this opportunity today just to remind you that we're here if you need further advice or support.
Hi, my name is Jenny Osborne. Just to let you know, we do have a direct line to our office, and to remind you of the number, it's 02890 553 182. There is an answer service there, so if you leave a non-urgent message, we will get back to you as soon as possible. However, if you are feeling unwell, we would ask you to contact your GP in the first instance. And if you're in treatment, we would ask you to contact the helpline of the treatment unit that you're getting treatment in.
Hi everybody, my name is Esther Gorman, and we're just delighted that you've been able to join us for our first ever virtual health and wellbeing event. And we hope the presentations that will follow you'll find very beneficial to you. But we will be available for any questions at the end of this session if we can help you anymore. Thank you.
Thank you, Karen, Jenny and Esther. You will now hear from Dr. Jennifer Doherty and Dr. Carol Stone about inpatient, outpatient and community services.
Hello, everybody. My name is Dr. Jennifer Doherty. I am a consultant in palliative medicine based at the South Eastern Trust, and I work in the Ulster Hospital. And I also work in Marie Curie Hospice in Belfast. My name is Carol Stone. I'm a community consultant with Fab Curie, and I also work in the Belfast Trust. So Carol and I are both delighted to introduce ourselves virtually to you today, and we wanted to just take the opportunity to talk a little bit about what we do as palliative care doctors, working as part of a team of people providing palliative care to patients. And we really just wanted to get the opportunity to think a little bit about how our services can help you. And because we both work in Marie Curie, we also have taken this moment to give you a little bit of an idea of what sorts of things Marie Curie might be able to help you with. So I suppose we wanted to really begin with just thinking a little bit about what palliative care actually is and why it might be helpful. And then thinking a little bit more about why palliative care might actually help you. Thinking around what our Marie Curie services provide, what they might be able to benefit you with. And we also wanted to take the opportunity to allow you to meet, albeit virtually, with our community and outpatients team in Marie Curie. And finally, just hopefully giving you the sense of how you might be able to go about being referred to some of the services we described today. So I suppose the whole idea of palliative care sometimes can be a bit scary, and it can be very frightening to have a diagnosis of cancer. And what I really wanted to say to you today was that palliative care is there to help, and it aims to help you live as well and as actively as possible. And the way that we do that is that we provide a holistic approach to your care, thinking about the physical, the psychological, and the social and spiritual aspects of all of those things that really matter to you. We assess and we manage symptoms. So sometimes I might be asked to see patients in the Ulster Hospital with the lung cancer nurses. And sometimes we see patients in the hospice for various different interventions, which we'll go on to describe to you. We provide information and emotional support, practical support for you and all those people that are important to you and help care for you. Sometimes it might be about addressing practical problems that you have due to your disease. And this might be things like thinking about aids to help maximize your independence or helping you access care if you need it. And all of this service that we provide works alongside your own healthcare professionals, your GP, and we very much deliver palliative care alongside any of the oncology treatments such as chemotherapy and radiotherapy that you might be having. So don't just take it from me that palliative care actually really helps. There's really good evidence out there to support that. And there was a study in the United States which showed that people diagnosed with lung cancer, newly diagnosed with lung cancer, who received palliative care from the start of their diagnosis, overall had much better quality of life and much better mood than those who didn't have the same access to palliative care and just had oncology treatment alone. So just moving on a little bit, what sorts of things can Marie Curie do for you? Well, Marie Curie, as some of you might know, has a hospice in Belfast. And our hospice is very much a place where we can provide short admissions for symptom control, and there might be symptoms like pain or breathlessness, or other things such as rehabilitation, maybe getting strength built up and regaining your independence. And of course, sometimes Marie Curie provides end-of-life care for patients as well. Some patients choose to come to us for that. We also have a thriving Marie Curie community and outpatient service where we provide outpatient clinics where you might be able to come up and be seen by one of our team. We have a full team, doctors, nurses, allied health professionals, and Carol will go on to describe that a little bit more in a moment. And we also have day procedures and the potential to do assessments in your own home. Region-wide, Marie Curie works all across Northern Ireland with its nursing service providing overnight home care and rapid response, working alongside the out-of-hours GPs. We also have a region-wide information and support line which can provide clinical information and support and information on accessing a range of services. We'll leave you with that number at the end of this presentation. So just moving along, I'd like to give Carol the opportunity now to talk a little bit more detail about the Marie Curie community and outpatient services.
So I have the pleasure of working with the Marie Curie community and outpatient team. So I think this slide gives you a bit of an idea of the membership or the makeup of our team. So I am currently the consultant working with the team, and I work with a team of doctors, with nurses and clinical nurse specialists, physiotherapists, occupational therapists, chaplaincy, complementary therapists, volunteers, and we all are part of the same team. And when you might be referred to us, you will usually be assessed by a member of the team, either generally the medical member of staff or the nurse specialist, who will assess what your needs might be, what your priorities are, and will then be able to refer you to other members of the team who might be able to help you achieve your goals. And the beauty of this is that we all work in the same building. We can make a referral by speaking to our colleague, and we prioritise and we are very keen that we respond really promptly to your needs. To give you a bit of an idea, a bit about a deeper understanding of the different services that we offer. So medical and nursing staff, we provide rapid access outpatient clinics, where we would aim to see within 1 or at the outside 2 weeks of being referred to us. We have consultant-led outpatient clinics, and we have medical review of challenging or difficult symptoms. We have, as I mentioned, our clinical nurse specialists who also help with our assessments, holistic assessments of patients, and helping to sort out any problems that may be arising. And if you need seen at home, we can usually organise that too. We also have our physiotherapy and occupational therapy team, and what they do is they undertake an individual assessment of what your priorities might be and what problems you might be experiencing that they might be able to help with. And that could be things like a musculoskeletal problem that has arisen that they can help address. It might be a change to mobility or fitness that they can help you achieve your goals in relation to that. It might be that you maybe would benefit from having some aid that would help you be independent, and they work with their occupational therapy colleagues in organising that for you. They will often do a domiciliary assessment where they might want to come out and see your house and get a better feel for how things are for you, and they run some individual programs, the most popular of which is our Fab Clinic. So Fab stands for fatigue, anxiety and breathlessness, and this group program has been online during the pandemic, and now we're starting to do that, offer that face-to-face, and it looks at managing those 3 symptoms in particular. And the team also work to assist with rehabilitation, say perhaps after a hospital admission, where you know, it sometimes happens that people lose a bit of fitness during that. Our patient and family support team are also an integral part of the team. So that is our social workers, a counsellor and chaplaincy. And the social workers undertake carer assessments and provide support to carers. We have the counselling service by our counsellor, and both the counsellor and the medical social work team and the chaplaincy support provide emotional support. But also we provide advice, whether it's legal with regards to benefits or finance, and also help with advanced care planning. We also do day procedures. So at present, we offer 2 day procedures, and that's likely to increase over the coming months. So one of the treatments we can offer in Mercury Hospice is treatment of high calcium levels, which requires treatment with medication that goes in an intravenous line. And the second treatment that we can do here is blood transfusions. And the feedback we've got from that is that people really value being able to come to the hospice for that and to be able to avoid going into hospital. So I suppose for the day procedures, we use one of the single rooms on the inpatient unit. So it's quiet, it's private, and it's comfortable in terms of having a hospital bed or a recliner chair. And we like to be able to organise these day procedures quite quickly after you're referred, so there isn't usually a wait. In terms of how to be referred to any of our services, so your GP or your district nurse or a hospital specialist, either a clinical nurse specialist involved in your care, such as the lung cancer nurse, or your oncologist can refer you to either our community and outpatient services or for an inpatient admission. Your district nurses are the people who organise the Marie Curie nursing service, and we would suggest that if you need a bit more information before you may want to request a referral to us, that you can contact the Northern Ireland Information and Support Services on the number provided. So this support line offers support on services, but also on various aspects of living with cancer, and also there's also a part of it that provides ongoing support and telephone contact if that's something that might be valuable. So I hope this has been useful, and if you have any further questions, please either speak to your healthcare provider, be it your GP or your hospital specialist, or contact the Northern Ireland Information and Support line on the number there. Thank you.
Okay, thank you, Jennifer and Carol, for the information provided there. We will now be hearing from Helen Murphy, who is a cancer-focused counsellor, and Helen will be talking about being more aware of your mental health at this stage of your journey.
Hello, I'm Helen Murphy, a cancer-focused counsellor, and today I'd like to take some time to explore ways to look after your emotional well-being after a cancer diagnosis. There will be time for questions following the presentation. Cancer Focus provides professional counselling across the province in each of the trusts, as well as providing a range of other support services for cancer patients and their families. These include our Family Support Service, which is for children who have a significant adult with a cancer diagnosis, art therapy, bra fitting, and our free phone nurse line. Details on how to access all of our services are on our website. Our counselling service takes place in a one-to-one, confidential, non-judgmental environment and provides a safe place to address the difficulties resulting from a cancer diagnosis and treatment. Recovering from cancer and its treatments is not just about your physical body healing, but it's also about allowing the healing of your mind, including your emotions. These are some of the typical responses which are often experienced very acutely on diagnosis and during and after treatment. A diagnosis can bring up a lot of uncertainties and questions. Why me? It brings new fears and anxieties about treatment and survival. Worry is normal, but it can take over. A diagnosis can bring low mood and sadness because of how life has changed, and it can be an extremely lonely place to be, as if no one else understands. The physical impact of treatment and surgery can result in self-consciousness and a loss of confidence. It's common to experience anger at the unfairness of the diagnosis, anger at your own body, anger at others, or at God. Any life changes we experience will need a period of adjustment. After a cancer diagnosis and treatment, it may be necessary to adapt to living with and managing a health condition. It's important to find ways to cope with uncertainties about the future. Patients face the challenge of developing a new sense of self, of accepting changes in their body or in their appearance. Patients may experience new sensations such as pain, numbness, fatigue, or the loss of bodily functions. And finding a way to navigate these very difficult changes is central to achieving a good quality of life. Patients may experience times when they feel very vulnerable at first diagnosis, when there's huge uncertainty about the outcome of treatments. Treatments may mean depending on others for care, bring feelings of helplessness or uselessness. Even when treatment ends, patients may feel particularly vulnerable without the safety net of review appointments and regular monitoring. A recurrence or a poor prognosis often brings more fears and anxieties. There are common psychological symptoms and problems. Worrying is at the top of the list at 72%. Feeling sad is really high as well at 67%. Patients often feel very nervous. Difficulty sleeping is very common. Feeling irritable, maybe as a result of not sleeping, and having difficulty concentrating, and have psychosexual problems. Cancer brings with it numerous losses. The impact on physical and social and emotional well-being, having to depend on others more, loss of identity, when who you were before gets lost in the side effects of medical treatments and hospital appointments, loss of a role or employment, maybe no longer caring for family or no longer at work, loss of self-esteem, loss of trust in our bodies, and loss of life expectancy, and at times loss of expectations about the future. The world can seem unsafe in a way that it never did before. When we experience loss of anything, we have a grief reaction and we mourn those losses. Cancer almost always brings about bodily changes, and these can affect not just how you see yourself physically, but also how you feel about yourself and therefore how you behave. The physical changes can change how we view our bodies, and our body image is connected with how we view ourselves, how we interact with the world, and how we function. Our minds and bodies operate together. Physical changes also have a psychological effect and can lead to anxiety and depression, low self-esteem from not being able to do what you used to do, adjustment problems, maybe struggling to cope with side effects of treatment, social avoidance, perhaps not wanting to cope with people's intrusive questions or gloom and doom attitudes. In extreme cases, there may be psychiatric disorders. Psychosexual problems may also be an issue. Cancer diagnosis and treatment affects the whole person. Our bodies, our minds, and emotions are all linked. Many cancers and all current cancer treatments may cause sexual problems. Estimates show that between 35 and 50% of all cancer patients are affected. These percentages are higher in gynae, colorectal, bladder, prostate, and breast cancer patients. Talking to professionals can be difficult. 72% of patients surveyed said that their sexual relationship was affected by cancer, and 66% of those felt unable to talk to their GP. This can be difficult for the patient and their partner because they may be unsure that the topic is appropriate. It may seem ungrateful or abnormal. It's not something we're used to talking about with professionals. Or maybe they don't want to bother the nurse or the doctor. For the professional, It may be that they are personally uncomfortable with the topic, or maybe they don't want to offend, or due to a lack of training or information, or even a lack of time or privacy. And finding a way to overcome the barriers to talking through these difficulties can make a huge difference. Managing stress is important in everyday life in general. This is one definition of stress. Stress occurs when there's an excess of demands over the individual's resources to meet them. If you think of a set of scales with resources on one side and demands on the other, we have a limited amount of resources, and we need a certain amount of stress to be able to meet deadlines or do exams or interviews, driving tests. But when it's prolonged or out of balance, then it becomes problematic. These are some of everyday stresses in general life. And they can range from something like having trouble with the car to going through divorce, money problems, work issues, unemployment. And none of these stop because of a cancer diagnosis. So often the stress that cancer brings is in addition to these everyday stresses. And then there are stressors which are particular to illness. Pain and fatigue are stressful for both the patient and the carer. Trauma, because anything perceived as potentially life-threatening is traumatic. Often the dynamics of close relationships can change. A partner can become a carer, or there can be a lack of communication between partners. Body image and sexual problems we've already touched on. Losses of health, body image, role, job, safety. Fears are also stressful, fears of a recurrence and about what the future holds. And the vulnerability of when treatment ends. It can seem sometimes like being abandoned by all the medical supports during treatment and regular appointments. Stress affects us physically, behaviourally, emotionally, and cognitively, and all of these are linked. Stress is exhausting, and tension can cause headaches and aching muscles. The stress hormones can cause digestion problems, a racing heart, and sleep problems, and behaviour is impacted. We may withdraw or increase alcohol or food intake as a way of trying to cope. Our mood is affected, as is our concentration, and our mood can fluctuate between high anxiety and panic or low mood. Lack of sleep can result in irritability and short temper. And then the negative thoughts are also impacted when stress is around. So it's important to find ways to cope in the middle of all these difficulties. A cancer diagnosis is one of the most difficult life experiences anyone can have to deal with and can be overwhelming. It can help to share your feelings. Who do you have that you can openly talk to about your feelings or situation? If you feel you don't have someone, professional help is available through your GP, other health professionals, and cancer charities like Cancer Focus NI. Don't feel that you have to be strong and struggle on alone. Friends and family are important, especially at difficult times. Often patients feel they don't want to burden anyone close, and yet loved ones can feel shut out by a lack of communication. Get good quality information from reliable websites and organisations or from health professions. Keep busy, but not too busy, so that your mind is focused on other things and you're not dwelling on uncertainties. Set achievable and realistic goals. Start with small steps and build on these. Often this can be encouraging as you move forward. Plan rewards when you achieve a goal. Say well done to yourself and be good to yourself. I'm sure you're familiar with how important these are. how important it is to eat and sleep well. Your body heals and is refreshed when you sleep, and also needs healthy nutrition. The advice is to go to bed at the same time every night, get up at the same time, have a bedtime routine where you wind down before going to sleep. Drink sensibly. Overdoing it may bring temporary relief, but it is a depressant and can lower your mood. It can affect your thinking and impact your medication. Be aware of your thoughts and how you speak to yourself. Often we can be harder on ourselves than we would be on anyone else. Ask yourself, would I speak to a loved one like that? Challenge negative thinking. Sometimes writing down the thoughts and looking for the evidence for them can be helpful. Solve problems as they arise and differentiate between what you have control over and what you haven't. Interests and hobbies help increase your confidence and interest and help you to connect with others. Make time for yourself. Chill out and relax. Ways of relaxing can include anything from music, pets, reading, crafts. Find something that suits you. Relaxed breathing is one of the simplest ways to relax your body and your mind. Imagine a balloon in your belly inflating and deflating as you breathe slowly in and out. Learn mindfulness techniques, prayer, yoga. All of these involve ways of meditating, and this helps our minds to slow down and to be more in the present. Be kind to yourself. Encourage rather than criticize yourself. Treat yourself the way you would treat a friend in the same situation. You might be surprised at how different that can be. Many support groups and classes are online at the moment, but they are available through cancer charities and on the internet, and it can be a helpful way to connect with others who have gone through a similar experience. Professional support and help is available to you from the clinical nurse specialists and medical staff, your GP, through counselling, the psycho-oncology service, and from Cancer NI free phone nurse line. Finding ways to live as much as possible in the present may be the best approach, although this is easier said than done. Living in the present moment takes some practice. So maybe start with living today. Ask yourself, what's important to me today? Yesterday has passed, and no one knows what will happen tomorrow. Really, all we have is now, and the more we live in the present, the better. A cancer diagnosis often makes people reflect on their life, reconsider their options, make new priorities, make or create changes, and reconstruct certain aspects of their lives. It's important to remember that cancer does not define you. It's a part of your life, but not your whole life. It may cause you to look differently at yourself and challenge you beyond what you ever thought possible. Thank you for listening.
Thank you, Helen, for giving us a better understanding of the emotional implications of having a cancer diagnosis. If you do feel that your emotional well-being has been impacted as a result of your diagnosis, then please let us know, and we'll be able to about that. Okay, so you'll now be hearing from myself about the Macmillan Health and Wellbeing Service and the wider supports available to you. And this presentation has also been pre-recorded. Hi all. So as you know now, my name is Nar and I'm the Macmillan Health and Wellbeing Coordinator for the South Eastern Trust. And I'm going to give you a bit more information about the Macmillan Health and Wellbeing Service. We're a trust-wide service here for anyone affected by cancer. We know that cancer doesn't just affect the person that's been diagnosed. It affects family, friends, colleagues, anyone who knows and loves and cares for that person. We're based in the Macmillan Information Centre here in the Ulster Hospital. We have an information zone and a drop-in facility, and our service is here to help answer any questions you may have or get you in touch with the right person who can. We offer support not just to people diagnosed with cancer, but to the public and healthcare professionals as well. In our information zone, we hold a wide range of leaflets and booklets. We recognise that it's so important that you have access to reliable, high-quality information, because lots of the information out there from Google or social media can be inaccurate, not relevant to you, and in some cases actually quite frightening. So we hold all of the excellent Macmillan information and information from all of our partner charities. Our information is located in different points throughout the trust area, in each of the hospitals, in libraries, leisure centres and GP surgeries. You will see that familiar green Macmillan branding. We deal with a range of topics such as cancer awareness, living with and beyond, dealing with side effects, practical issues, information for family and carers, and information on local support. We hold the information in a variety of formats, such as large print and easy read, as well as other languages. We want the information to be easily accessible so that we meet all information needs. If there's something in particular you're looking for or need, just let us know through the chat function and we'll get that sorted for you. We understand that no two people will have the same experience, and this will have been and continue to be very personal for you and your family. But we have found that these key areas emerge, and that's where we would want to offer our support and guidance. Our team is part of the wider cancer services team, and we're very much a catch-all, one-stop shop to help you explore all of the supports available to you. It's a very efficient way for you to get support. So if you're finding there's anything you're coming up against or that you want to talk about, we want you to pick the phone up and have a chat with us. There's no deadline to our support, so you can come to us at any time with any questions, thoughts or feelings which may come up, especially as you reflect back on everything. At this stage, in post-treatment, the areas we focus on more would be healthy lifestyle and physical activity, which you'll hear more about in our next two presentations. We also find that we hear about finances and work at this stage, and we offer work support conversations, which includes things like how to talk to your employer about your diagnosis, letting people know their rights at work when they do have a diagnosis, and how to plan a return to work so that it's successful. At this stage again, managing side effects such as fatigue is another area of our support. And we also offer practical support for patients, which includes transport to and from appointments, advice about travel insurance, or even dog walking services. We understand that there are a whole raft of emotional implications that come with a cancer diagnosis. We find that it's not uncommon for people to feel quite emotional when they come through their treatments. Often, it's only at this stage you can stop and start to make sense of what's actually happened and understand what that means for you going forward. And exploring these emotions and feelings is also a very normal part of your recovery and moving forward. It can be a very hard step opening up about how you're feeling, but we do want you to reach out. Our drop-in facility operates on Tuesdays and Thursday afternoons from 2 to 4 and Wednesday mornings from 9:30 to 12 in our new Macmillan unit. We offer a one-to-one appointment, which is staffed by myself and two support workers. Their names are Gemma and Nicole. We have an in-depth awareness of all of these supports and services available to you. There's so many, but we will talk to you, get to know you, and let you know all of the relevant supports available. And we'll signpost you to them or make referrals where necessary. We're very lucky. It's a lovely service to work for because it's a non-clinical setting. We don't have to watch the clock, and we can spend plenty of time with you so you can tell us where you're at and how you're doing in order to tease out those areas that could be improved, putting things in place that are really going to help build you up and live well going forward. If you have any questions, please get in touch using the information on your screen. Thank you. Okay, so I hope you all found that information useful and are more aware of the various supports and services available to you at this stage of your journey. We're now going to hear from Stuart McCulloch and Wesley Henry, who are physios in the South Eastern Trust, and will be giving you all more information about breathlessness management.
Hello, my name is Stuart McCulloch and I'm a respiratory physiotherapist in the Ulster Hospital. Between me and my colleague Wesley Henry, we're going to spend the next 10 minutes or so just talking a wee bit about breathlessness management and a few tips and techniques along the way. So what happens whenever we breathe? Normally, air is drawn into our chest whenever our diaphragm flattens and the chest cavity expands. The opposite happens when we breathe out. The diaphragm domes up, the chest cavity gets smaller, and then air leaves our body again through our mouth or nose. Normally this process is easy and effortless. Unfortunately with breathlessness that's not the case. It's uncomfortable. It's that awareness that we need to work a little bit harder at our breathing. This is usually worse whenever we exert ourselves or whenever we're in a stressful situation. And it's common, it's complex, it involves a lot of things, mind and body, and it is likely to progress with disease severity. That being said, it doesn't always correlate, and sometimes whenever we measure things in hospital like your lung function or your chest x-ray, that doesn't always match up to how you're feeling. And so it is important to say that breathlessness is very individual and unique to the person experiencing it. What causes it is a long list of things. Lung cancer is one. Other respiratory conditions like asthma or COPD that you may have also can cause breathlessness. Heart disease, neuromuscular weakness, obesity, deconditioning, anemia, it's a long list. And basically that's all to say that if your breathing or your breathlessness changes all of a sudden, it is worth getting checked out and assessed just to see if there's something else going on, there's some other reason why you're worse, and therefore something that can be treated that can help. This little slide just indicates the relationship between what we do and how breathless we feel. And usually people try to avoid breathlessness because it's not a pleasant symptom to experience. Unfortunately, when we do that, you end up doing less, you become deconditioned, you lose some fitness, your muscles get weaker, and then the whole thing takes a lot more effort whenever you go to do something, and suddenly you find that doing tasks that you used to be able to do quite easily are starting to make you breathless, and it's a vicious cycle that we can get into. Thankfully, the opposite is true, so if you push yourself a little bit, a wee bit of breathlessness is actually okay, it's good, just to get a bit fitter, get the muscles stronger, get a little bit more efficient at how we breathe and use the oxygen, and then we can start to be able to do a bit more and not be as breathless as we were before. This little slide just talks about medication that can be used to manage your breathlessness. Low dose morphine, often in liquid form, can help just take the edge off a little bit. Other medication like diazepam, lorazepam can be helpful, particularly if there's an anxiety element to your breathing. And then there's a list of medication that can help, very much depending on what is the issue, what else is going on. Steroids can help reduce inflammation. A nebulizer is really useful to help open up your airways if you're tight, as is an inhaler. Sometimes we use saline through a nebulizer to help clear mucus. Blood transfusion if your blood count's low. Antibiotics if there's an infection. And diuretics or water tablets can be used if there's any sign of heart failure or fluid overload, which can also impact your breathing. Oxygen therapy, so oxygen is also a drug. It can be prescribed, and it's important to say that oxygen normally in your body will sit somewhere between 94 to 98%, and we measure that with a little finger probe. There is no evidence that giving oxygen to somebody who's breathless will help unless that is low. Okay, so people can have low oxygen levels without necessarily feeling breathless. Far more common and more often people can feel breathless without their oxygen levels in their body being low. It's only if those oxygen levels are low that giving you oxygen will help.
Breathlessness can be challenging and hard to live with at times, but there are ways that you can reduce how much it affects your life, as well as the medications and oxygen therapy that Stuart has just discussed. There's many other coping strategies and tools, including breathing techniques that can help. Breathlessness can make you breathe with your upper chest and shoulder muscles rather than using your diaphragm and lower chest. This causes fast and shallow breathing, which uses much more energy and can leave you feeling tired. An important part of managing breathlessness is learning a technique called breathing control. This uses your diaphragm and lower chest muscles to help you breathe more gently and effectively, and it can also help you relax. It's important that you practice these exercises at times when you're feeling less breathless, so you can use them whenever you feel more symptomatic. Breathing control or good breathing essentially means moving air in and out of the chest with the minimum effort and using the right muscles. This gives you the correct amount of oxygen and carbon dioxide you need to live and feel well. Breathing control can be performed and involves using the main breathing muscle, your diaphragm. You can do this by sitting nice and upright in a chair with your upper chest and shoulders relaxed. It involves breathing in and out slowly through your nose and feeling your tummy moving in and out as you're breathing. This will help you breathe more efficiently, effectively, and reduce the sensation of breathlessness. Another useful technique for managing breathlessness is called positions of ease. These include sitting forward leaning with your elbows on your knees, standing forward leaning perhaps with your arms on a windowsill or a table, or it can be side lying in bed with the use of pillows. These positions are helpful in reducing breathlessness as they help to relax the muscles of the upper chest and shoulders and allows your diaphragm to work much more efficiently and effectively. Another useful tool includes pursed lip breathing. This involves breathing in slowly through your nose for a count of 2, puckering or pursing your lips as if you're going to blow out a candle, then breathing out slowly and gently through your pursed lips while counting to 4. Planning and pacing is also very important to help manage breathlessness, as this allows us to conserve energy while remaining active. It involves adapting functional tasks to make them much easier and includes breaking tasks into smaller manageable chunks, taking frequent breaks and pacing ourselves. Also making sure that we're gradually increasing the energy or effort required for the task. Make sure you give yourself enough time when planning to do physical tasks, and if there may be some aids that can help, such as walking aids. Now, breathlessness can also be made worse and caused by sputum retention or secretions in our chest. This may be the case if you have a chest infection or if you're also living with other chronic lung diseases such as asthma or COPD. It's important that you keep your chest clear each day by performing some simple breathing exercises such as the active cyclic breathing technique shown on the screen. This is a really simple set of breathing exercises to help remove mucus and keep the lungs clear. It involves deep breathing, tummy breathing, and a technique called huffing, which involves taking a medium breath in, then breathing out forcefully through an open mouth. If you keep your lungs clear, this will certainly help reduce that sensation of breathlessness. Other useful tips and tools include simple measures such as keeping a window open or using a handheld fan. It has been shown that a handheld fan can reduce breathlessness even within 1 to 2 minutes of use. Relaxation techniques are important, as often when we feel anxiety and panic, that can make our breathlessness worsen. The calming hand technique is particularly useful at times if breathlessness is related to feelings of anxiety and panic. Other useful tips include making sure you're using good posture, particularly when we're sitting and standing, to allow the chest and lungs to expand easily, and avoid wearing restrictive clothing when possible. Thanks for listening, and hopefully some of these tips will be able to help you manage day to day with breathlessness. Thanks.
Okay, thank you, Stuart and Wesley, for the information provided there. We will now hear from Emma Hagan, who's Movement Coordinator in Bangor, and Emma will be talking to us a little bit more about physical activity and cancer.
Good afternoon, everyone. My name is Emer Hagan, and I am one of the Macmillan Movemore coordinators. My job is to look after the physical activity side of your care and recovery. I am one of 11 Movemore coordinators throughout Northern Ireland. We have one coordinator in every council area, so you'll have everyone on the call will have access to a Movemore coordinator. Our role is to encourage everyone living with and beyond cancer to get active and to stay active. And it might be to get back into an activity that you've done before your diagnosis, or it might be to find a new activity that suits your needs now. We know there's huge benefits from being physically active, both socially and physically. Most importantly, we know that physical activity can help combat some of the side effects of the cancer treatment. Cancer-related fatigue is a massive issue that a lot of patients will talk to us about. That on not being able to shift that massive weight of tiredness off post-treatment and going through treatment. Now, a lot of the research now does show that the more physically active that you can be, the less that fatigue will reduce. There's also great social aspects to getting physically active, getting back outside after 18 months of us all sort of isolating, getting back outside, doing some walking, maybe back joining a group. My role in our Ards and North Down area is to encourage you to get as active as you can. It might not be within a leisure centre, it might be at home, it might be outside with the grandkids or children, but we do offer some Movemore classes throughout the borough and across NI. All council areas will offer some different classes. There'll be some outdoor walks, outdoor activities, indoor Pilates classes, circuit-based classes, dance classes, etc. We are really, really conscious that people are maybe a little bit frightened still about coming into the leisure centre environment. But please let me reassure you that all classes are run socially distanced, masks are worn, and we have created a very safe and social environment for everyone to come back to the centres. Now, that might not be for you, and you have an opportunity to have a one-to-one chat with myself or one of the coordinators to discuss what you would like to do and where you would like to do it. And Movemore is very patient-centred, okay? So we can talk about activities that, as I said, you used to do, or maybe a new activity that you would like to try, and we can help you build a little plan to get you back feeling fitter, stronger and healthier. We know all adults across Northern Ireland aren't active to the levels that they need to be. The recommended levels is 150 minutes of physical activity throughout the week, and we know only 53% of the population in Northern Ireland can reach those levels. So I'm here just to encourage you, even if you're thinking about getting a little bit more active, even if we could aim to try to do 10 minutes a day of activity. It can be from housework, it can be going for a walk, a cycle, it can be going to the gym. It doesn't have to be something really, really structured that you think you have to be in a gym, etc. It can be at home, and we now have online resources through Movemore. We have exercise DVDs that you can do at home, but we do also have the classes available and access to local leisure centres, gyms and swims. If you would like to get involved, please contact me on 077 18 19 4434. I will be available at the end of the talk for any questions or answers. And if you're not from the Ards and North Down area, please still get in touch with myself and I can pass you on into the correct coordinator's details. We are going to show you now a little short video of Movemore and all that Movemore represents and stands for. Just to make you aware, the video was made prior to COVID, so it was back in the times where there's no social distancing, so don't be alarmed. But it's a good wee flavour of the patient's view of Movemore, what the classes look like, etc. And I hope you really enjoy it.
Afternoon, ladies. Everybody fit and well and ready to get active? Excellent, let's get going. At present, 63,000 people are living with cancer in Northern Ireland. That means that 1 in 2 of us in our lifetime will be affected by cancer. Physical activity is often referred to as a wonder drug. It can help combat the side effects of cancer treatment. It can help reduce the occurrence of long-term health conditions and can also help reduce the chance of the cancer spreading and returning. We also know that physical activity and exercise is safe both during and after most types of cancer treatment.
I was diagnosed with cancer in December 2015 with lymphoma. I was a very keen cyclist, very fit. During my journey I put on quite a substantial lot of weight, from 15 to 23 stone. I got involved with the Move More programme simply because my wife volunteered me. I then went to the class, which I realised I wasn't on my own, and I never looked back.
Move More Northern Ireland helps people living with cancer get active and stay active. Macmillan Cancer Support funds the project, working in partnership with local councils, physical activity providers, health and social care trusts all over Northern Ireland to provide physical activity opportunities for people living with and beyond cancer.
We're burning this morning. Hands and feet together. That's great, okay? We'll just do 2 more and we're back to the march, okay? This one is squat. Sometimes it can be hard to know when to start to build up your fitness after you receive the cancer diagnosis, and that's where our Move More coordinators can help. Our coordinators can provide specialised and tailored support on an individual basis to help you get back to a level of fitness that suits you. Move More is not just about the gym or running marathons. It can be any activity that suits you and you enjoy.
I'm David, and I was diagnosed with a brain tumour just over 2 years ago. We'll come here for exercise in the water, which is very pleasant, much better than exercising in the gym, I find. The water supports my weight and really enjoy it.
We have David here in the pool, and David's been swimming with us for about 6 months now. It's really helped his mobility and walking. It's not just about a gym, it's not just about classes, it can be any activity that you enjoy. It's about moving more.
My doctor took me into a test for bowel cancer. I wasn't going to do it, and I'm glad I did. If I hadn't had the operation, I'd be dead now. I've been told that. I enjoy every day. I try and give back as much to Move More, to Macmillan. Friendship is absolutely fantastic with these classes.
Taking the first steps can be daunting, but that's why we're here.
You find your stride will go back further. Right.
We're here to make it easier and to make you feel like yourself again.
This is going to be exercise for the arms. That's it.
I try and make my classes as appealing to lots of people, so I don't want my classes to be boring. I want them to come along and have a range of different activities. So we maybe do a wee bit of Chai Me, and to warm up we could maybe do a wee bit of Pilates, exercise to music, even boxercise, different activities. It's going to cater for everybody.
But dancing does not at all feel like exercise, because you're concentrating so much on counting and following the steps, but certainly it does raise your heart rate a lot more than the Chai Me element of the class.
You've been in the house so long by yourself quite a lot, as I was ill. So it is again the social interaction and just meeting people who are similar. It's a good boost to your confidence, really.
I started the classes when I was about halfway through 16 chemotherapies. I continued here whilst I was on radiotherapy as well. For me, I remember a lady saying to me, get out as much as you can when you're going through treatment, when you're feeling well enough, get out, be busy. Stay active, and that's very much what I did.
I'm Alison. I am actually a nurse in the breast care unit in the City Hospital. Ironically, I was diagnosed with breast cancer in July. We send a lot of our patients out into the community, and I actually didn't know what all Macmillan did. So, you know, whenever I was invited to come along to this exercise class, I mean, my eyes were opened at how much they support you and get you into exercise, and you know how important it is. Equally, meeting up with all the other people that are in the class.
those with poles, just put the poles out to the front. Okay, so we're just going to rotate the left leg. Okay, and now the right
Through
leg.
Move More, Macmillan wants every person living with cancer in Northern Ireland to become and remain active. Finding the right activity makes all the difference.
The support network that you have through the hospital or through Macmillan and through the friends that you meet at classes like this, it's that gets you through.
I move better, I sleep better, I eat better, quality of life just generally improved.
Life with cancer is still life. We'll help you to live it.
Okay, thank you, Emma. So at this point, I'd like to introduce our final speaker, Julie Dorian, who is an OT in the South Eastern Trust. And Julie will be giving us more information about cancer-related fatigue.
Hello, my name is Julie Dorian and I'm an occupational therapist and I work for the South Eastern Trust in the community. So some of you may have come across occupational therapy, and for those who haven't, the process of occupational therapy is looking at everyday tasks to improve independence and quality of life. By occupations, we mean the ordinary and familiar tasks that we do every day, that we take for granted until we become ill. Cancer, its treatments and the recovery period can affect our daily occupations. And today I am here to talk about cancer-related fatigue, the cause of fatigue, its impact, and most importantly, some practical measures to help continue those activities that are important to you. So have you ever felt like this? I'm sure many of you can relate to this picture. I'm very mindful that you've already sat through a lot of the slides and talks today, and you could be experiencing difficulties with concentrating. I'll discuss some of the impacts of fatigue later, but it can be a very difficult thing to describe in terms of how we feel. And I suppose I just want to ask, have you been able to tell anyone how you felt? There is evidence out there that people often suffer in silence and they don't mention it to their family, to their friends, to their doctor or their healthcare professional. But the evidence says that fatigue can be the most debilitating, disrupting routines and everyday tasks. So what is cancer-related fatigue? Fatigue can sometimes be confused with tiredness, and we would expect that after a busy day, when we feel tired and we go to sleep, that we wake up and we're fine. But cancer-related fatigue is different, and it can be described as an unusual and persistent tiredness. It interferes with our day-to-day functioning, and it is not relieved usually by sleep or rest. It's not proportional to recent activity. I remember one lady describing feeling absolutely exhausted, and this was before doing anything, and it was at the beginning of the day. And it can be very subjective, so it's a very individual and unique experience, and everyone will experience fatigue differently. Many assume that fatigue generally accompanies illness and recovery, and as we said, and therefore they don't mention it. But statistically, it states that 70 to 100% of patients are affected by fatigue at some point in their cancer journey. And it's important to know that it is a recognised medical diagnosis. And we will talk a little bit later now about the ways in which we can manage it. So what are the causes of fatigue? You can see in this diagram that fatigue is a very complex system. And it's not only the cancer itself and the cancer treatments, but there are your emotional distress. It might be lack of activity, or it may be problems with sleep. So how does fatigue affect you? For some, you may experience mild symptoms, while others may experience severe symptoms impacting on the areas identified here. So physically, you might lack energy, or you might experience shortness of breath even after a very light activity. You might even struggle to get up on bad days. Cognitively, so those are our thought processes, You might notice that you're slower in terms of your thinking processes. I can remember one lady describing having a foggy brain and really struggled to try and concentrate on reading a book. Emotionally, you might notice that you're more irritable or you're anxious and you feel very frustrated and more stressed. You might lose interest in things that you once enjoyed, and you might feel less motivated, and you may feel sad or depressed. Socially, this might impact on roles and relationships with family and friends. You might feel too exhausted to go out, and you begin to avoid going out and socially interacting with others. Your spiritual well-being may be affected too, and you may question the meaning, purpose, and value of life. And you might even have feelings of hopelessness. So how do we manage our fatigue? So the key to managing fatigue is to recognize that it is a multi-dimensional problem. Therefore, it is most likely to respond to a combination of different approaches via the multi-professional team. So it's important to talk to your doctor, talk to your healthcare professional, talk to your nurse. They can help and try and work out the cause and how to manage your symptoms. It's important to treat any underlying causes, and your doctor can check for any medical problems that can be treated, such as anemia, pain, or depression. The non-pharmacological management of fatigue, and the remainder of this presentation will focus on this. And this is the practical measures of how you can manage your fatigue. So how can we cope with fatigue? So in this picture, you can see a child with a money box. And the idea is very similar to our energy levels. You can see the child putting all the pennies into the money box and saving them up. And when they open that money box, they have to really think very hard on how they're going to spend their money and what they're going to spend their money on. Energy is the same. You have to really think about what you want to use it on. So in order to do this, and you may have already adopted some of these principles of what we call energy conservation, the 3 Ps: planning, prioritizing, and pacing. So planning ahead, and sometimes this can be a challenge in itself, and it does sometimes take a little bit of practice, but some people find it useful to use an activity diary to plan their day and week ahead. Prioritizing, again, this will be a very individual choice and what's important to you. So what are the things that must be done and what things can wait? And even think about what others can do. And I know it's very easy for me to talk about it. And being a very active and independent person, it can be very difficult to rely and ask for help. One lady I spoke to found it very challenging to delegate tasks to others in her family. She felt that perhaps they might think that they're very lazy, or that she didn't really want to let them down. But when we discussed the challenges that she was facing in terms of her fatigue and her day-to-day management, family were very supportive and wanted to assist. So pacing yourself. By pacing and spreading some of the activities which demand a lot of energy, those we call high energy tasks, we can learn to better manage our days and weeks ahead. You may be familiar with the boom and bust scenario, where you feel that on a particular day you might have quite high energies yourself and your fatigue is well managed. And then what we do is that we tend to cram a lot of high energy tasks in. And what we notice then is that we pay the price in the coming days and you're fit for nothing. So this is why it's important to pace yourself. When we're planning and pacing, remember to slot in rest breaks. And also allow yourself extra time and think of ways perhaps in what you can do and something that you can do in a different way. So as an occupational therapist, We can look at ways together to help manage your day and week ahead. And sometimes it's a simple change in an activity or a small aid that can make a big difference. There was one gentleman that I worked with, and he had a real passion for cooking, but he recognised that completing every meal in the day and throughout the day was just too demanding. And as an occupational therapist, I provided him with a perching stool in the kitchen, and this allowed him to conserve energy, and he was still able to continue his role. He also delegated some of those preparation tasks to his family, and one family member became his sous chef. And it just allowed him then to continue his passion for cooking. As an occupational therapist, we can keep into a good sleep routine is recommended. Keep into a routine, going to bed and waking up at the same time has its benefits. While you might be tempted to sleep through the day, it can disrupt your sleep at night. There is some evidence that there are benefits to a short nap of around 20 to 30 minutes, but anything longer is not recommended. Exercise, which has already been highlighted, is one of the best ways to managing fatigue. And in fact, some studies show that avoidance of exercise and activity can make your fatigue worse. Your nutritional intake, so fueling the body, has its benefits. And this can be very difficult whenever you're undergoing some treatments and you have nausea or vomiting. But a dietitian can advise you if you have any issues. Stress levels. How can you manage your own stress levels? And this can be something very, very individual. For some, it's relaxation. There's many apps out there that people have found the benefits of. Finding things that are enjoyable and fun activities. Even talking to somebody how you're feeling can help with relieving your stress. Some people enjoy meditation, others complementary therapy. But like I said, it's an individual choice and it's something that you can only decide. So if we just put this all together and we imagine our body as a human battery, if you put a lot of demands on the body, then the energy in the battery will go down and you need to replenish it. So the demands like dealing with stress, family demands, the anxieties of the have-to-dos, household demands, dropping the kids off to school, recovering from illness and return to work. And even that voice in your head, those guilt, the guilt of, oh, you haven't got that done. So we notice that our battery then starts to go down. And what we would recommend is that you don't get to the stage of having a flat battery. So in order to recharge our battery, we need to think consciously of how we're going to supply it. So things like relaxation, having a good diet and nutrition, sleep routine at night, doing fun things you enjoy. It might be something that you've never done before. Exercise and activity. And as we mentioned earlier, the 3 Ps, planning, prioritizing and pacing. And then setting goals. So in order to increase your energy levels, you can set goals, but it's important to be optimistic and yet realistic. And your occupational therapist can help you to do that. Resources available on fatigue. And if you would like further information, you can go on to the Macmillan website. And there is information that can be accessed through booklets, leaflets, and audiobooks and recommended apps. Or just pick up the phone and give us a ring. I hope that this information has been helpful. Thank you very much.
There haven't been any questions that have come through the chat function there. So if you do have any questions, then please contact us at a later date and we'll aim to answer those for you. So that's really it for today. We hope that the message has been that regardless of what stage you are at in your treatment or beyond, you're not alone. We are still here and we all want to help and support you. We understand that there are many implications of having a cancer diagnosis, that there will be times when you need reassurances, when you need to talk things through. And if this is the case, then please get in touch with us. We are still here, your team is still around you, and hopefully today will have given you some things to think about. So if you do need any information or have any questions, then please get in touch, and thank you for attending today. Upon leaving the event, you'll be asked to complete a short evaluation. Your feedback will be greatly appreciated as we continue to develop these events. Thank you.